The Best Docs Network helps you find some of the best doctors utilizing the latest procedures and practices in healthcare. Actual patients and the doctors themselves walk you through their stories that together help you make the best decision in your search for the right doctor. On today's episode, ENT Dr. C.T. Wynn talks about a procedure called balloon sinuplasty. Bariatric surgeon Dr. Scott Stowers with My Bariatric Solutions changes his patient's life with a lap band procedure. Clinical psychologist Dr. Collins Hodges discusses how he is able to help families adapt to life changes. Interventional cardiologist Dr. Annie Varghese talks about cardiomyopathy. And doctors from Forest Park Medical Center utilizing the latest in technology and techniques.
Originally, I was having a lot of sinus pressure. Pretty much all the time I had sinus pressure. And I had a lot of headaches. I would have sinus infections pretty much back to back. I'd have several sinus infections a year.
Amanda has consulted multiple Reddy Clinic urgent care that does not really address her problem. All they did was to refill her prescription of antibiotics, gave her some antihistamine, and tell her to go home. What they do is they treat her symptoms instead of treating the cause of her problem.
He basically just looked at my nose and kind of tried to figure out what the problems were based on the symptoms. And he noticed immediately that my turbinates were really big.
The inferior turbinate, it's a normal structure in your nose that everybody has. It has a role of filtering and humidifying the air that you breathe in. So it becomes enlarged and inflamed when it is irritated by either allergies, infection, or pollution in the air. Considering her busy schedule, we decide upon a two-pronged approach treatment. Balloon sinuplasty in office to treat her sinus issue, and inferior turbinate reduction to relieve her nasal obstruction.
I don't really have any more sinus issues. I haven't had a sinus infection since the surgery, and it's been a few months now.
The advantage of balloon sinuplasty is that it can be done in office. There is no general anesthesia. The cost is less than doing it in the hospital, and the recovery time is really quick. There's really no downtime. The patient can go back to their daily activities quickly.
It's actually kind of funny. There's a lot of things that I didn't realize were issues until after the surgery. I know one time I was sitting in my bathroom and I was sitting there and there was a candle about 2 feet away from me, and I actually could smell it. And that was something that I have never done before, and it kind of just hit me. I was like, you can actually smell the candle.
Drink green tea. It's packed with heart-boosting and cancer-stopping polyphenols that black tea doesn't offer. Green tea also delivers a boost of alertness, but from a smaller dose of caffeine than black tea.
About 20 years ago, I've started jogging and been quite an avid jogger during that 20-year time period. About 10 years ago, I tore my medial meniscus, and I had to have some surgery done on it, and went back into jogging. And then about 8 months ago, I started having trouble again with my medial meniscus.
Phil's a middle-aged, 50-ish age patient that was, playing some sports and twisted his knee, felt a pop, had a little bit of swelling, some medial-sided knee pain. So we evaluated him, we got an MRI. It showed that he had a meniscus tear. The meniscus is the structure between the thigh bone and the shin bone that provides cushion for our knees.
I went to Dr. Chris Wong. At that time, he put me into some rehab, and then we both decided that I needed some surgery done.
What we did was look inside of his knee, arthroscopically, making 2 little portholes, and then trimmed out the torn part so that it doesn't rub and cause him pain. Most things can be treated non-operatively, sprains, strains. However, things that need surgery are like large meniscus tears, loose bodies, people that have knees that are locking or getting stuck due to structures getting caught in there. And we can now, do surgery through 2 or 3 little bitty holes.
Going into the surgery, I think we're all nervous when we have a surgery done on us. That's just part of being human. But it went very smoothly. Dr. Wong and his surgical team, where I came in, visited with me shortly before the surgery. We went in. I was there about 3 hours, maybe 4. And out, they arranged to have physical therapy rehab machine that was put on the knee, and faithfully used that for about the next 4 weeks. And I've been on several recent trips where I've walked an incredible long ways and done some limited jogging, and it's worked out very well for me. Bottom line is the knee is better, significantly better, and within a few days I was back up and walking and doing quite well.
To learn more about Forest Park Medical Center and their doctors, go to bestdocsnetwork.com. Find your doctor on bestdocsnetwork.com.
I've experienced in my past excessive weight gain. I would diet, lose, gain, lose. I was embarrassed. I was ashamed. I didn't feel good, and the more I gained, the less I felt confidence. I had made the choice that I needed to really make the decision to change my life, to get my health back on track.
Charlotte had a lap band procedure, which is one of the most common procedures that we do. She's been very successful for her. She lost her predicted weight that she wanted to, and the several different medications she took, she doesn't take anymore.
I decided to have the bariatric lap band at My Bariatric Solutions. I have a lot more energy. I strive to do things that I wouldn't have before, experience some exciting things on some of my travels.
A band is put in laparoscopically through small incisions in the skin. We put the band around the top of the stomach, and it's a balloon, essentially. It has a port that goes up under the skin, and we can put salt water in there and tighten the band up. That keeps the food in the top of the stomach and makes people feel not hungry with a small amount of food. It works like a long-term diet, only you feel full with small amounts of food. The most important part of a band patient doing well is frequent follow-ups and getting their band adjusted, especially early on. First 6 months, we will normally do about 5 adjustments until they learn how to use the band. After that, maybe 1 every 6 months, and then later on, maybe once a year.
My experiences with Dr. Stowers and his staff is so easy. I arrive, I'm seen in a timely manner, in a professional manner, and people are so friendly and they treat me as a family. Each time is very special, and I look forward to seeing the doctor. He's very friendly, very cordial, and very professional all at the same time.
John has a question for Dr. Guy Lewis. Can you do a full smile makeover in a day?
We can do a full smile makeover in a day if you want to do bonding. Bonding is a tooth-colored filling material that we can use to change the color and the shape of your teeth, and they can be done just like veneers, but it's made out of composite, which is a different material. It looks good and it can be very, very nice, but it's not as long-lasting as doing it with porcelain. So if you want to do it with porcelain to get a more long-lasting, a better result, I think in most cases, then you need to do 2 visits. And then you come in the first visit, we get the teeth ready, take impressions, then we have to send it to a lab, and they prepare the porcelain and send it back, and then we put that on at the second visit.
Ask our doctors on bestdocsnetwork.com.
My son was going through a transition of graduating from high school and entering a new chapter in his life. And so I think there was some anxiety on his part. There was some anxiety on my part. It was coming out in negative ways, and we had to identify what's going on, and we needed somebody, an outside person, to kind of help us mediate and facilitate through some of the feelings that were going on.
Alma and Quattro were great. I really enjoyed working with them. They were both very sweet, very bright, very interested in working in therapy. They initially came to see me because Quattro was moving along in his development. He was moving into young adulthood, moving off into college, and part of the conflict there was, what does his move into college and his developmental move into young adulthood mean in terms of the renegotiation of boundaries between mom and son, and then the renegotiation of roles between mom and son.
Dr. Hodges provided a great environment. He's a facilitator and a mediator, and that's what me and my mom needed in our relationship at the time.
The main change that I saw was a better understanding from each of them as to what their new role was going to be. They both came to a better understanding as to who they were, not only as individuals, but as a close mother and child.
Dr. Hodges gave us some really good guidance and encouragement, and through love and trust, we were able to get through some tough spots and have some success.
After seeing Dr. Hodges, it just gave me and my mom a greater respect for each other as individuals, and just has taught us to learn and grow with each other. Dr. Hodges has helped me realize what progress is and how to obtain it.
Keeping your social networks alive and well may help benefit your ticker over the long term. Social support has been linked to a lower risk of heart disease, and people who do have heart attacks fare better if they are socially connected.
So John is a wonderful man. He is a father, he works every day. But unfortunately, he developed coronary disease at an early age, weakening of the heart because of that. So when he presented to me, the heart function was very poor.
I was a jock, watching my diet. I loved exercise. I ran marathons. I was an NCAA certified basketball and football official. And the people that I worked with, they knew me and knew that I was a fairly healthy person. So when they found out I had a heart attack, everyone was floored.
Heart failure means the heart becomes weak, whether it's because of blockages or other things. Viral illnesses can cause heart failure, but for him it was blockage, not getting enough blood, so the muscle became weak over time.
Before I started seeing her, they wanted me to run through a battery of tests. And when she saw the results of those tests, and I believe she was on maternity leave at the time, she came in and wanted to see me. And it was at that point she actually brought up that somewhere down the road I may actually need a heart transplant.
Over the years he's been evaluated by the transplant team, and he didn't need a transplant because we had taken great care of him, and he's very thankful for that, and I'm thankful for medications and therapies that we were able to give him to keep him really controlled on heart failure.
Dr. V is an amazing person. I owe quite a bit to that woman, and I feel very fortunate that she's my cardiologist.
He did have a device, a shock box put in, so that in the event of an arrhythmia, because the vessels are not working and the muscles not working, so electrical abnormalities can occur, and people can have sudden death from heart failure. So we protected him by putting a shock box. And he has been able to work every day, but he takes his medicines and he's doing great. So that's a great testament to having great doctors paired together and great institutions to take care of patients. And we're very blessed here in Texas because of the Texas Heart Institute.
You notice something about Forest Park Medical Center the moment you walk through the front door. Gone are the smells, the sights, and the sounds that are typically associated with most hospitals. And in their place is something decidedly different. You see, Forest Park Medical Center was designed to be comfortable, inviting, even calming. Fact is, many of our patients don't want to leave. Come experience for yourself what medical care should be. Forest Park Medical Center, your destination to better health.
I didn't feel good about myself and I never wanted to go anywhere. Now my world has opened up. I occasionally go out with my girlfriends and we have a great time together.
I was getting older and didn't really care about my weight, but my doctor said I needed to do something immediately. Now I'm spending time with my grandchildren and every moment seems special.
My one reason was to live life again.
My one reason was to simply live.
So what's your one reason?
Barker Bariatric Center. Log on or call today for your consultation.
Coming up on the second half of today's show, cosmetic dentist Dr. Guy Lewis gives a patient renewed confidence by giving him a new smile. Family medicine doctor Richard Honecker addresses common health concerns in our Medical Minute. Minimally invasive spine surgeon Dr. Douglas Wan talks about his approach to spine care. Vein specialist Dr. Peter Morgan talks about the benefits of using the Claravane procedure to treat venous insufficiency, as well as more doctors from Forest Park Medical Center utilizing the latest in technology and techniques.
I probably wouldn't have done it if my wife had not persisted and said it meant something to her. The discussions about my health and my heart and how the teeth over time could affect it, and that I finally gave in and did it for my wife.
Ed comes in and he wants to get all this work done, and so we basically did a full mouth on him, and his teeth were broken down. He had had some dental work a long time ago, but it had basically gotten redecayed and some problems there, so he needed to have a lot of this done.
The thought of being able to come in and get it done, I'll say one sitting, although it's pretty long sitting, was probably the appeal to doing it that way.
So we did the smile lift on Ed, where we opened his bite some, and to get them in a better position, increased the color, made them whiter, brighter, and got them more in alignment to where they weren't hitting all different places. And the results are amazing.
Not like any dentist experience I've ever had. And I had thoughts when I was young about being a dentist, and had a couple good family friends that were dentists, and the experience was nothing like any dentist I had been to.
He's busy, but he was able to come in and we could do this in a couple of visits and get the major things done. These are normal results for us, but you look at it and it's pretty dramatic. But that's what I get to see every day. That's what I love about my work. You get health, get things cleaned up and looking good, but also make it look awesome.
Again, I don't smile too often, but it's amazing how many people stop me, whether it be a TSA agent at the airport or a waitress or someone I'm doing business with that says, boy, how beautiful your smile is. And as a man, I'm reluctant to say, oh, well, yeah, I've had cosmetic dentistry. So I just kind of say thank you, and I said I've been blessed, and I have. When I look in the mirror and smile, yeah, it makes me feel good now.
Request an appointment on bestdocsnetwork.com.
As men grow older, their prostate glands swell. That's a natural phenomenon. The prostate gland is located right under the bladder, and when it swells, it can cause some urinary symptoms. For example, the urinary stream may be weaker, there may be dribbling, you may only go in small volumes, and it may take you a long time to get your urinary stream initiated, to get started going. So what can you do about that? First of all, you can just be aware that this is a normal part of aging. There are certain things over the counter, something called SAW Palmetto, S-A-W Palmetto, which you can use to help reduce some of the symptoms. It's not real effective, but it works somewhat. Reducing your caffeine, and your alcohol will help the prostate work a little bit better. Now, surgery can be done, but that's rarely done anymore. There are 2 or 3 drugs that can be prescribed to help your prostate work better and reduce those symptoms. So if you're tired of having people yell at you while you're waiting in line at the urinal at a ball game, then you may want to start on some of these medications. You can just ask your doctor and he'll walk you through that.
I've been seeing him now for about a good 10 years. A lot of it was for diabetic ulcers. He says he would like to try something on me. He wasn't too sure if it was going to work, and I'm glad it did work.
Karen is a diabetic with a non-healing ulcer. We were treating her at the wound center. We had tried numerous modalities to try to get the wound to heal. So what we ended up doing was going to stem cells. By applying stem cells, we were able to heal the wound. Diabetics are more prone to ulcerations due to the fact that usually they're neuropathic and have poor circulatory perfusion to the lower extremity. Stem cells are very beneficial for wound healing and also tissue repair, just for the fact that they have abundance of growth factors. What's lacking in a lot of diabetics and a lot of patients as we get older is our lack of growth factors for our wounds to heal. And a lot of times, by introducing these stem cells, we are able to introduce these new growth factors to stimulate the wound to progress and heal.
I trust Dr. Lou totally, and so does my family. He's very personable, he's very honest, and he will tell you straight out what you need to do, and I trust him.
After the stem cells are applied, it's followed with a dressing, and then basically the patient remains not weight-bearing for approximately 2 to 3 weeks. Usually on the first visit, after about the 4th, 5th day postoperatively, upon removal of the dressing, we do start to see some healthy tissue growth. Karen's doing well. We have her right foot, which had a non-healing wound. Within application of the stem cell itself, we had the wound healed within 2 weeks.
My husband trusts him. I have a lot of faith in him, and I don't want to quit seeing him. You know, I want to keep coming here. I don't want to see any other doctor for my feet.
To learn more about Forest Park Medical Center and their doctors, go to bestdocsnetwork.com.
Find out more about your family history. Finding out what your grandparents died of can provide useful and life-saving information.
And we welcome you inside the Best Docs Network studio. We are happy to be joined by Dr. Doug Wan. And when it comes to spine and neck surgery, this is your go-to doctor. He is also the director and founder of Spine Care. Dr. Wan, welcome to the program.
Thank you. Thank you for having me.
Let's start it off with your philosophy when it comes to your approach to medicine. What would that be?
So we practice medicine based on, our approach is very patient-centric, providing the best care for the patient. And when it comes to spine care, spine problems are a very complex issue. And so our approach is to approach it with a very comprehensive approach. So in our center, we have from the least invasive way to the most complex way of treating spine conditions. And we have providers such as chiropractors, physical therapists, physical medicine rehab doctors, interventional pain specialists, and minimally invasive spine surgeons. And we approach it through a multidisciplinary approach and find the best way to treat the patients so that they get the most amount of pain relief.
All right, doctor, what was your goal in creating Spine Care? What did you have in mind?
When we created Spine Care, our goal is to provide the best kind of spine care to the patients. There are many patients with a very complex spine problems. However, not everyone may need spine surgery, so we approach the spine through a multidisciplinary approach, and we find the best way to treat the patients with significant back pain. That's why we have from the chiropractor to physical therapists, physical medicine rehab doctors, interventional pain specialists, and minimally invasive spine surgeon. we find the right diagnosis and treat the patient the right way and the least invasive way possible so that they can get their life back as soon as possible. Also at the spine care, we have high-level imaging so that patients do not have to travel elsewhere to get their imaging studies done. Also, we have our own procedure centers on campus, so therefore they can not only get the evaluation, but also pain procedures done, as well as spine surgery.
To see the rest of this interview, as well as other outstanding videos, head to bestdocsnetwork.com. Terry has a question for Dr. Steve Duffy. Is there a downside to not having a gallbladder?
So we treat a lot of gallbladder disease here in Texas. And that's one of the most common questions we get is, what is my life going to be like after surgery? The most common thing people notice is that for the first couple weeks as their body's adjusting, if they eat fatty foods, greasy foods, they tend to get some abdominal discomfort, they can get some changes in their bowel function. But once your body's adapted after this period, you can live a normal life with essentially no dietary restrictions.
A recent study in the Journal of Periodontology shows that 2 ounces of yogurt a day may protect you from gum disease. The typical container of yogurt holds 6 ounces, and the good bacteria in yogurt helps fight germs in your mouth.
Clarivain is a new procedure. It's been out maybe for a year or so. It is a procedure that is associated with less pain, both during the procedure and post-procedure. Patients that have venous insufficiency that don't have it corrected are going to get worse. The question is, how fast will it get worse and how bad will it ultimately get? And that's dependent on the individual, how much of their problem is hereditary or genetic and how much is occupational. The typical presenting signs and symptoms, which include pain, swelling, restless legs, enlarged refluxing vessels. If you have the venous insufficiency corrected, the disease progress will completely stop, and if it recurs, it can be easily treated without significant intervention. When you use laser or radiofrequency ablation to close veins, it's an energy source that produces heat. And so you're essentially burning the veins using radiofrequency or laser. And in order to control that pain, you have to put a tumescent solution, which is a numbing medicine mixed with normal saline, around the vein all the way up the leg. And so that requires several needle sticks, which is uncomfortable, and then that makes the leg kind of full, maybe a little tight, and there's some leakage of the fluid. And with the Clarivain, that tumescence not needed because Clarivain basically has a mechanical agitator, like a skip rope, that spins inside the vein and traumatizes the lining of the vein, and then we inject a sclerosant solution that augments the effect of the skip rope. When you use an energy source, there's always a risk that you could damage a structure that's adjacent to or near to the vein, such as a nerve or maybe even muscle, that sort of thing. And so with Clarivain, since there's no laser, there's no radio frequency, you're not using a heat source, and so it's, I think, significantly safer. All of the procedures are very safe statistically. The number of complications is very minimal, but I think there is some benefit with the Clarivain with respect to complications.
Watch more videos on bestdocsnetwork.com. Didn't find the doctor you're looking for on today's episode? Head to our website, bestdocsnetwork.com. There you can search our video library by topic, specialty, and doctor. The Best Docs Network, helping you find the right doctor and bringing medical education to you.